Okay, so now we're going to shift over to Rachel Jewkes, who is joining us from South Africa, who is a person that I look to a lot for what's great research, programmatic, how is she connecting the work on the ground? She's in communities doing this work. She's building bridges between communities and working a lot, both at the global level and local level. So, Rachel, global goals, violence against women, South Africa, take it away.
Thank you very much, and yeah, sort of good morning, I guess it is, to all of you once more. What I want to do is to talk a little bit about the sort of central topic, and then I'm very happy to engage much more in conversation around issues I've raised, but also what's happening on the ground in South Africa. I think that if we talk about global goals, the first thing I'd just like to reflect on is what's the role of researchers within this agenda. And I think it's very exciting because we do have a very clear role. And part of the role is clearly to guide policymakers and NGOs and donors towards evidence-based interventions, actions and investments. There's also an important role in continuing to generate knowledge, because much as we feel that we're learning more and more and we're in a much better situation than we were 2 or 5 years ago, there's still a tremendous amount more that we need to understand in terms of drivers of violence against women and girls. And we need to much better be able to learn and synthesize insights from evaluations of interventions that are on the ground, new interventions, and in particular to understand more about the economic aspects of trying to prevent violence against women and girls. I think that we also need to look longitudinally across the next 15 years, because we should be planning to document, interrogate and evaluate the global efforts and generate learnings from the coming 15 years, because much as I think we're sort of galvanized for action now about how it is we capitalize on this opportunity to be able to prevent violence through the global goals, I think it's very important that we look ahead to plan how we're going to learn from this opportunity. And if, as Maureen was suggesting, the worst case scenario happens and the global goals are not well translated into action on the ground in many countries, we need to really understand what happened and why this particular one wasn't, or the particular ones that actually impact on violence against women and girls relate to it as an issue, why they are not implemented, and if there really is good action, we need to understand what it is that's driven that, because undoubtedly, the next 15 years will go much faster than any of us expect them to, and then we'll be presented with a position in 2029, 2030, where we're looking ahead at the next set of goals. And we need to make sure that whatever we achieve over the next 15 years is accentuated over the following 15 years. So we really do need to make the most advantage we possibly can of this opportunity. And we need to push the boundaries of our knowledge at all times on how to do the work better. So I think there's always a tension in the field, because on the one hand you want to condense down a fairly simple message to policymakers, preferably in a tweet, so that people can pick it up when they're incredibly busy and they know what to go out and action. But on the other hand, we really need to maintain an awareness of what we don't know, because if we don't maintain that awareness and keep it very much in the forefront of our minds on the research side, we're not going to be able to address those gaps in our knowledge and learn how to do things better. So I want to just talk for a minute about what it is that we do know, and what I want to share are some of the findings of a comprehensive review we did in 2014 when we were in the inception phase of our WhatWorks to Prevent Violence global program. And this first slide here gives a synthesis of the evidence that we found on primary prevention interventions. And as you can see, I've presented 2 columns, which at the bottom are headed fair evidence and insufficient evidence. And you'll probably note that there isn't a column headed a wonderful huge amount of evidence, and that actually is because the field doesn't have a huge amount of evidence about any of these areas. The other thing is, if you look at the rows, the bottom one is ineffective, then there's conflicting, promising, and effective. But as I said, even the top row of effective interventions is the caveat there is that there aren't a huge number of evaluations of these interventions. But let's look at what we have in that row. Well, the bullet at the top says microfinance and gender transformative approaches. And I think it would be true to say that since this slide was put together, we would prefer to talk more broadly about economic empowerment approaches for women combined with gender transformative approaches. Microfinance is one type, cash transfers have been tried, and different other types of economic empowerment approaches, and there does seem to be some evidence, or a fair amount of evidence, that these are effective. The next bullet is relationship-level interventions, and I think that workshop-based interventions to transform masculinities are sort of very closely linked, so either working with women and men as couples or working with men separately and boys separately and women separately. These interventions, an example of which is the Stepping Stones program, we now have a fair amount of evidence that they're effective. Group education with community outreach for men and boys, it says here, but I think we would also say now with women and girls within the community. There's a fair amount of evidence that that's effective. And we don't have a huge amount of evidence, but it's very promising what we've got that shows that you can reduce violence against sex workers by collectivization, and alcohol reduction programs have some support within low and middle income countries because there clearly is a link between the use of violence and alcohol abuse. On the promising side, there's fair evidence around parenting programs, but this is more to do with the fact that parenting programs are successful in preventing violence against children, and we know that child abuse is an incredibly important driver of subsequent experience of violence. There isn't evidence that parenting programs impact on any of the subsequent violence experiences because that research has never been done. There's no research with that longitudinal perspective that would be required to show that. Community mobilization, there's an increasing evidence around social norms approaches, and school-based work is promising. And then there are areas that are conflicting. Bystander work mainly comes from the States. There's very little work elsewhere. Findings are conflicting. And there are a couple of areas where we don't think that at the moment they look very promising at all. And on this slide, I've basically summarized some of the interventions which are primarily developed as response interventions, but we often think about as prevention, and they're often spoken about as prevention. And Maureen again just mentioned the fact that the violence against children interventions in Tanzania were framed quite largely around response interventions, and we find the same thing in the field of violence against women. It's very common for people to grasp at response interventions when they get pressurized to think about what should be done in terms of prevention, or rather that's quite common at a country level. And you'll see that actually there's nothing in the top line that was shown to be effective. There's fair evidence around protection orders and shelters as protecting the individual women who get admitted to shelters or take out protection orders, preventing subsequent violence against them. But obviously the focus of those interventions is more complex and is very much framed as as trying to prevent violence against those individuals rather than in the community more broadly. There is conflicting evidence around batterers programs and advocacy interventions, And there are a number of areas where there actually is quite a lot of evidence that they don't work, and one of which is screening within the health services routinely for violence against women and girls, and another area is looking at mandatory reporting. And then there are a range of other programs that people have mooted as being possibly effective for prevention, but actually it's not primarily what they're set up for, and there isn't evidence really that they play a preventive role. So I think that we are in a position where we have some very clear interventions that are designed as primary prevention interventions, and then we have the group of interventions that are often positioned as prevention interventions, but really they're responses. I don't want to come across as sounding as if I'm sort of knocking that group, if you like. And I don't actually think that within our field that there should be any question of there being an either-or in terms of prevention and response. What we really need is a both-and. And I think in the response area, we particularly see some actionable policy areas. And the first is basic legislation criminalising violence against women and girls, including rape in marriage. There are over 50 countries that do not criminalise rape in marriage, and many countries don't have a specific part of their criminal code which addresses the question of violence against women and girls. Absolutely fundamental if we want to build prevention through the global goals. The second area is having the political and social will amongst law enforcement agents to provide justice and protect victim survivors. Provision of protection orders, including what I've called weapon surrender. It's basically if somebody's used violence and a protection order has been taken out against them, that if they have a weapon they should surrender it. And this is important to prevent murder of women who've experienced violence by partners. And services for victims, counselling, health services, shelter. And all of these are actionable policy areas that are needed in conjunction with investment in the prevention of violence. I just want to touch on for a moment a question about opportunities in the pipeline. And I'm currently leading the WhatWorks to Prevent Violence global program consortium together with my partners, which I've shown here. And this is one of three components to an overall £25 million UK government DFID-funded programme called WhatWorks to Prevent Violence that was established in December 2013 and will run until April 2019. And the other components are looking at violence against women and girls in conflict and humanitarian crises and economic and social costs of violence. And I think it's very important that these three components sort of come together, as one of them is focusing very much on prevention. In conflict and humanitarian crises, there's a need to combine response and prevention very clearly. And I think it's very important that we don't forget those settings where the issues are slightly different than they are in more peaceable settings. And we need to consider economic and social costs, because the key thing there is that's how we build the case for more investment. So the global program is working in 14 countries, and if you can see the map on the right, you can look for all the red pieces, and you see they're largely in Africa, but also in South Asia and in Tajikistan, which technically is in Europe. And we have the occupied Palestinian territories in the Middle East. And we're basically supporting three pillars of research within the global program. The first is further work understanding drivers of violence. The second pillar is evaluations of interventions. And then the third pillar is looking at the costs of intervening. And the intervention pillar is divided into basically four groups of interventions where we're generating knowledge. And I'm not going to read all of this out, but as I talk, you can look at it. But we have a set of interventions that are looking at different approaches to economic empowerment of women, and some of them of men, and gender programming. And what's interesting is I mentioned earlier that it's not just microfinance. We now recognise there are lots of different types of economic empowerment that work, but there are some things that we need to move in and understand more carefully. So I want to, for example, the first one is in Afghanistan, and in extremely conservative settings, it's possible that the way in which empowerment works is different from in other settings. We need to understand that. The South African project is being undertaken in informal settlements or slums. And in these areas in South Africa and in Kenya and Bangladesh, which are 3 countries I've looked at the evidence from, the prevalence of violence is about twice as high as it is in other areas. And so we really need to understand what works in these very difficult contexts. And then the last one here is looking at workers employed in the workforce in garment factories. And that raises very interesting questions around what we can do with formal workers, because we mustn't forget that a lot of women are in the workforce in countries, and economic empowerment isn't just about providing microfinance, but it might be about providing gender empowerment programming to women who are already working. The second group is working with children, and we've got projects in Afghanistan, Pakistan, working through schools, and also a self-defense project working with slum children in Kenya, and a project looking for working with children, providing psychotherapeutic support in families where there's a combined problem of alcohol abuse and violence in Zambia. Our third group are social norms change programs, and we've got a range of them working usually community-based through community action teams in different ways, and one of them is using television for programming in Palestine. And then the fourth group is interventions with couples, and we've got different modalities of interventions, and some of them are more complex, and the one at the bottom is specifically working with sex workers and their intimate partners, so different types of couples. So that gives you the overview of the global program. I just want to mention the conflict and humanitarian crises piece, which is looking at the prevalence and drivers of violence in that context, including violence against men and boys, and looking at what works in prevention and response, thinking about economic interventions in this setting, service delivery and intersections between violence against women and girls and the policy agenda in humanitarian crises. And then the last component is looking at the economic and social costs of violence at individual, household, community and national levels. They're planning to develop a methodology that I think would have applicability way outside the WhatWorks countries, and provide information for governments, for donors and financial institutions about why they should invest in this area. So I think overall that from the research side, we really need more investment in research so we can better understand how interventions work and can be optimized. We need to continue to emphasize the need to focus on the economic side, because we do, as we begin to know more interventions work, we need to ask different types of questions about the cost effectiveness of different types of interventions. And the key policy question for governments, I mean, if you go to a national treasury and you say we've got this lovely Stepping Stones program and it's been shown to reduce violence by 32%, they're going to say, well, okay, how would you roll it out and what would it cost us? We need to be able to answer these questions, and I think quite soon they'll say, and why should we spend money on that rather than on a microfinance program? We need to look at delivery platforms for scale-up, because actually that's quite a barrier. It's not something that can't be overcome, but it's something that we need to face, because most of the interventions that have been developed and evaluated through NGOs work within NGOs that operate in quite a limited geographical area. And so we need to think about how we can scale up. And I think there are some very important lessons for the donor community here about how to scale up whilst maintaining the integrity of the intervention. So it's not just about deciding you're going to scale up SASA, the intervention from Uganda, and then going out and asking NGOs to do it, but you need to define quite carefully what it is, because at the end of the day you may end up with what's being implemented being quite different from what was originally evaluated and found to be effective. So there needs to be some careful work around that. And then we also need to do work on new modalities of intervention, and there isn't anything like enough known about how to intervene on substance abuse prevention, depression, provide depression treatment in a low and middle income country setting in a way that's scalable. And we don't understand what contribution that can make to violence, even though these are important drivers. The issue of parenting, I mentioned, there's much more that needs to be known. And whole school interventions, we need to understand much better about how they can work and in what circumstances, because schools do provide a really ideal scale-up platform if only we can optimize the intervention to scale up within that context. So basically, I've tried to provide quite a sort of swift overview, and I'm very happy to discuss this either in questions now or when we get to the discussion part. Thank you.
Thanks, Rachel, very much. People are clapping. Can you hear them clapping?